When an individual has a posterior collateral ligament sprain, approximately 40% are isolated, with 60% being concurrent to some other type of injury. The primary mechanism of injury for a PCL injury is a knee hyperflexion. The secondary type is an anterior contact that drives the knee posteriorly forward. This can be something like landing on a flexed knee at 90 degrees. It could be things like collision with goalies in soccer. You'll see it in car accidents when a person has a dashboard impact, or in skiing when somebody impacts on a falling tree. It is estimated that about 47% of all PCL injuries are sports related. With this injury, you will notice trace to mild joint effusion. The individual will complain of deep posterior pain as well as pain with kneeling. The person will seem to have normal gait when walking, but it's painful during deceleration while that person is running. The person may also walk with the knee slightly flexed to avoid terminal extension. Range of motion will be decreased if effusion is present. There are many special tests that can be used for PCL injuries. Godfrey's 90-90 test will be used, and this just consists of lifting the legs and looking for a sag. You can also use a posterior drawer test. Posterior drawer test can also include a test for posterior medial rotatory instability and posterior lateral rotatory instability, with the Houston test combining the internal and external rotation while doing the posterior drawer. You may also want to try other PMRI and PLRI tests with concomitant injuries. You can do tests such as the external rotation recurvatum test for PLRI. You can also perform a reverse pivot shift or a Jacob test. Neurovascularly, you're going to want to check the popliteal artery, so you'll test the dorsal pedal pulse as well as the posterior tibial artery. The PCL is diagnosed through an MRI or X-ray. Treatment-wise, isolated PCLs usually heal on their own, but one thing you have to remember is that a torn PCL may increase the chance of an ACL tear later.